My name is Joanne Zannoni, and I'm the Executive Director of the New York State Coalition Against Sexual Assault, otherwise known as NYSCASA. NYSCASA is a statewide coalition of community-based rape crisis programs that are certified by the New York State Department of Health to provide a wide range of free confidential services for victims of sexual assault. For 25 years, NYSCASA has advocated for the effective response to all people affected by sexual assault. We've done this by providing information, training, materials, and other resources to rape crisis programs, allied professionals, policymakers, media, and the general public. Strengthening veterans' access to sexual assault intervention services would certainly support our continued efforts to address the needs of all victims. Research indicates that the rates of sexual assault in the military are high, and that many factors make it difficult for victims to report while they are still serving in the military. For example, 60% of women have experienced military sexual trauma in the military reserves and the National Guard. Some estimate that as many as 80% of sexual assaults in the military go unreported. Rape in the military is much like rape in the family. It's where you live. It's not just where you work. These statistics might seem hard to believe, but it's important that we believe victims of sexual assault. If we fail to believe that such crimes are committed or that the perpetrators of those crimes are solely responsible, we will not offer an appropriate response or take effective action. The reactions of victims' social support networks and the responses of various systems with which victims commonly interact are often less than ideal, and they are a source of added trauma. Victims of sexual violence are at higher risk than non-victims for experiencing depression, anxiety, addiction, eating disorders, suicidality, and other mental health problems. However, effective resources are available to assist victims of sexual trauma. Studies have found that the services provided by rape crisis programs make a difference. Rape crisis programs provide victims of sexual assault with free, confidential services, including but not limited to 24-hour crisis hotlines, advocacy and accompaniment, information about options, referrals, and individual and group counseling. These services help to decrease the length of time that victims experience rape-related symptoms of post-traumatic stress disorder and strengthen their ability to regain control of their lives. Victims of sexual assault consistently want to be believed. They want access to confidential support. They want to be able to choose the options that best promote their recovery. These seem such small requests, and yet these requests are all too often denied or ignored. While there are efforts at the federal level to improve the response to sexual assault within the military, we should do our part at the state level, especially when simply providing information about existing resources can make the difference between our veterans getting or not getting help. The purpose of S6342 is to disseminate information at the Office of Mental Health and Department of Veterans Affairs websites about where veterans can seek treatment and counseling for military sexual trauma. In consideration of the many veterans living with military sexual trauma and the difference that appropriate services can make in the lives of sexual assault victims, ensuring that our veterans know about treatment options seems the very least we should do. Thank you for this opportunity to provide some testimony.
Thank you very much, Ms. Zannoni. Do any of my colleagues have any questions for Ms. Zannoni?
Yeah, let me ask you. So, what can we do to, what can we do to bring this issue forward, so they feel they have an opportunity, or they feel they have the protection that is necessary for them to bring something like this? Because it's just like you're saying, it's sort of like occurring within the family, but at some point in time, how do we get them comfortable enough where they can come outside of the family and express their concerns or express these violations that they're going through?
I think a number of things are helpful. One is just getting information out there about that this actually does happen, so people know that they're not alone, that they are believed. Our responses have to not be those that are victim blaming, because people, it's hard to come forward if you've been sexually assaulted. And so part of it is just setting the stage so that people are not afraid to come forward.
Right.
Victims do not want the world to know what happened to them, so confidential services are critical. If people are going to come forward for help, they need to know that there are options, and that they get to decide which options are best for them. So it's a number of things. Also, if we do not enforce consequences for the perpetration of these crimes, then a lot of victims will decide it's not worth coming forward. Trying to get, trying to bring perpetrators to justice.
Right. Instead of making the victim the perpetrator.
Right. If we don't bring perpetrators to justice, then victims, the experience for them is just added trauma, and many decide it's not worth coming forward and taking steps.
I think that's a good point, because a lot of victims are concerned about the trauma and the way things are being conducted lately. With the women are the ones who are the victims, but all of a sudden the tables have been turned on them.
Yes.
Thank you. Senator Huntley, you had a question.
Now, I just wanted to say, basically when women go into the military, they go for the same reason that men go, in terms of making rank. You know, it's like if you work for a large corporation and you're raped and you need the job and everybody's looking, you're not going to say anything. And I think part of the, with the veterans, you're home. Like you said, you live with those people.
Yes.
24/7. And possibly the person that raped you, or the persons that rape you, they could be your lieutenant, your whatever. So what do you say? And then on the other hand, a lot of times people say things, but then people don't believe them. Yes. I mean, I have seen cases where it turns out to be the woman's fault, you know, and I think people say that, even in court cases, you know.
Yes.
They're always trying to say, well, you had on a short dress, or you bent over, or you smiled at him, and I think the same thing basically goes on in the military. So that's why they're not coming forth to talk about it, and that's something we have to change. I don't know how, because when you live with people, it's very difficult to do that.
Right. Because absolutely, trying to report this while in the military, there are lots of possible outcomes that could just be even more damaging to the woman who's already been victimized. It could have career implications, but also her safety, her daily safety, is dependent upon these people that she's surrounded by. Mm-hmm. So it's very difficult to come forward while still in the military. Yes.
Do you also see in the military is not like the workplace. There's a hierarchy. There's a totally different environment. And does this make it more difficult in terms of the victim pursuing justice? And what happens if the victim does decide to file a complaint within the military and their very structured existence?
Yes, I'm not an expert. Yes, that's all right. I'm not an expert about what happens in the military, but my understanding is that the structures in place can make it difficult for victims to come forward because, unlike other service providers or other reporting mechanisms that provide confidentiality, you really don't have that within the military. And so, also, those serving in the military who've been victimized might be told, you have to report in a certain way. You cannot share this with someone you consider a friend. So there's certainly structures in place that are not especially victim-friendly. And I know that there are efforts to try to improve that, but there's a long way to go. There really is.
Well, I was just curious whether, in your estimation, there's been an increase in the number of sexual assaults over the past decade, or, I mean, do you see a rise, or is it leveling off? And
I don't know whether there has been an increase in the number of assaults that have taken place within the military. My understanding is that there are certainly more reports.
okay.
So it may be that people are feeling more able to come forward and report, and probably that will continue as policies and procedures and services improve.
So this particular piece of legislation that really asks for there to be discussion of this particular issue amongst the veterans administrations and certainly in New York State, that someone should be able to go to their VA clinic or wherever and be able to say, look, I need this dealt with, and get some referrals somewhere.
Yes.
Because right now that doesn't happen at all. I mean, it's just as though there's no problem. I mean,
which in some ways is very shocking to me. But yes, apparently that is the case, that referrals are not made to their free confidential services provided by rape crisis programs throughout New York State. And if services are needed that extend beyond what our programs would normally provide, then those programs give referrals. They provide information and referrals to other professionals who can address other needs.
well, what is it? Okay. Are there any other? We've been joined by Senator Liz Krueger, and just finishing the testimony, that's quite all right, of the executive director of the New York State Coalition Against Sexual Assault, and talking about the number of victims of sexual assault, and 60% being women in the military.
According to one report, that that was the number of female victims.
Okay.
Yes.
Well, thank you so much. Does anyone else wish to ask? Well, thank you so much for your testimony.